My name is Jackie Skidmore, and I'm the director of the Usdan Institute for Animal Health Education here at AMC. Tonight, we're so pleased to have AMC's own Dr. Chick Weisse with us. He completed his small animal surgical residency training at the Veterinary Hospital of the University of Pennsylvania in 2002. He then pursued advanced training through a customized fellowship in interventional radiology at the Hospital of the University of Pennsylvania in 2003. He held dual appointments in surgery and radiology as an assistant professor at both the veterinary and human hospitals at UPenn before coming to AMC in 2009 as staff surgeon and head of the interventional radiology service. We're very grateful to have him speaking here tonight, and without further ado, please welcome Dr. Weisse.
Thank you, Jackie. Okay, can you guys hear me okay? Okay, great. Well, welcome. I'm so pleased to see so many of you here tonight after a long day. Promise I won't keep you long. But I just want to ask, how many of you have been to one of these events before? Okay, this is the first time for all the others. How many of you specifically came because it was about tracheal collapse? Oh my God, okay, that's great. How many of you have a dog with tracheal collapse currently? And how many of you are currently are seen through our hospital? Okay, most of you, okay, great. So my experience with tracheal collapse really began as a surgical resident in the early 2000s. I was a surgical resident, and this is a difficult disease, and I became very frustrated with it because we'd see these like otherwise healthy animals. This is a benign condition, right? This isn't cancer or something. This is a benign condition, and it takes animals' lives, and it's very serious. And you know, there are some medical options, there's some surgical options. We got into stenting because that's what they do in people sometimes, and we're one of the first groups to really explore stenting, and I'll go over that with you, and I'll show some images of that a little bit later. And that's what a lot of people come to us for, because we have a lot of experience with treating that. And it really, when I was a resident, I had a dog with collapse that needed a stent, and I had the human interventional radiologist from the human hospital come over, and they helped us do it, and then we started a dialogue. We started working together. I started working over at the human hospital with them, and they'd come over and work with us. And that's how I got to do my fellowship over there and really help develop kind of the growth of moving a lot of the technology from the human side to the veterinary side, specifically for tracheal collapse. That was the first interventional procedure I did. And interventional radiology is not what you think of maybe when you think of radiology, like x-rays and things. It's using image guidance to gain access to different structures in order to deliver materials for therapeutic purposes. Now that sounds very complicated, but what it really is that you use image guidance like live x-ray or endoscopy to open up something that's inappropriately closed, like the trachea could be inappropriately closed because it's collapsing and we could put a stent in, or a blood vessel. If you know someone has ever had a coronary stent or a renal stent placement, it's the same thing, but we're putting it in the airway or blood vessels. Or we could close things that are inappropriately open, like the blood supply to a tumor. We can embolize it, take the blood supply away, or close down a vascular anomaly. So tracheal collapse is something very near and dear to me because it was really my entrance into the world of interventional radiology. And seeing so many of you that have brought your animals here, many of you have contributed to what I'm going to present to you tonight. So hopefully you're aware of this, but when you come in here, we take records and we keep data on your patient, and we have studies that are ongoing, and we often have consent forms for you to sign if it's an ongoing trial or something like that. But then we look back and see what we've learned from this. And because we do stents more than probably anybody else, we have a lot of tracheal collapse dogs come to us. And that has provided us with the ability to get a huge database of patients where we can look back and learn a lot about this disease. And when some of you have come through our clinic, you know, we don't always have a lot of time, and there's a lot of questions, and there's something about tracheal collapse dog owners. They're incredibly well read on this. They've looked online. They get good information and bad information online, but it's a long process dealing with this. It's hard seeing a dog struggle to breathe. So there's a lot of research that people do, and they have a lot of questions. So this lecture is really just me telling you the answers to all those questions. And I'm going to explain to it a little, because I have more time now, what we've learned. And I can tell you what I am going to tell you tonight, many veterinarians don't know. because I see a new tracheal collapse patient every 2 weeks in this hospital. I mean, it's a tremendous amount of dogs that are affected with this condition. And we know, you know, you could ask your vet, we know how, if you have this dog has this type of cancer, if it's spread or not spread, if you give this type of chemo, how long they'll live, the median survivals. We know if you have heart disease, if you have a murmur and a big heart, or not a big heart, but a murmur, and you get this drugs, how long they'll live. If you have kidney disease, how high your kidney values are, we know how long you'll live. But something as common as tracheal collapse, if you ask your vet, how long is my dog going to live, no one knows. And because of our ability to do research here, and a lot of you guys who have helped fund a lot of the research here, we have students, veterinary students, every summer that come and work with us, and they update our database. We have a massive database, over 200 patients probably, and I'm going to go through those results with you. And I'm going to explain what you've read online, why it's either right or wrong. Okay? So we'll go through this from the beginning. I don't know if you could hear this. This is Prince. Prince. Cute little dog. Prince, come here. As long as you keep him quiet, he's okay. But you could hear, this is his breathing. Look at the camera. Oh. This is awesome. And it's a cute, funny little noise, but if someone rings the doorbell or they go on a car trip, he's going to get into a crisis. And we'll show you why that is. So we're going to go through what tracheal collapse is, how we treat it, what's the prognosis, and how we can learn more about all this. So we're going to start with an overview. And then the paradigms are all the stuff you read online and the stuff I learned as a veterinary student, and how much of that's true and how much of that is false. So let's start with what tracheal collapse is. So dogs are like people. We all have tracheas, okay? A trachea is your windpipe. People are a little bit different. So our voice box, your trachea starts just below your voice box. So you feel your Adam's apple, your voice box, that's your voice box or your larynx. Your trachea begins just below it. And in people, our trachea is very short. It's about from here to here, and almost all of it is inside the chest. Where a dog, half of his trachea is in the neck, and half of the trachea is in the chest. And that makes a big difference of where the collapse is, on whether it's an inspiratory problem or an expiratory problem. That's why we keep asking you all these questions about the location. But it's made up of these, I'm not sure this laser pointer is working. I think it might have just died on me. I don't know if you guys have another laser pointer. I think this one's going to go. But these are cartilage rings. And there's little C-shaped cartilage rings, about 35 to 45 of them in a dog, with little ligaments in between them. And they're made out of hyaline cartilage. This is the same cartilage that's in your joints, that keeps nice, smooth joints, your bones rubbing against each other nicely. And just like our joints get old, our tracheal cartilage can get old. And if it loses the water content of it, there's a lot of things that changes in the dog's trachea when it has tracheal collapse. If it loses some of the elements of the cartilage, it loses its integrity and kind of becomes very flaccid and floppy. So instead of being a nice rigid tube like this, when these get very flat, flaccid, and this membrane on top of those C-shaped rings, it kind of stretches, and then this just kind of collapses. And if you imagine sucking through a straw, if you breathe through a straw very gently, it's no problem, right? But if you try breathing very fast or hard, the wall sucks together and you can't breathe. And that's why a lot of our management is keeping these dogs quiet, so they just have nice, gentle, quiet respirations, turning the lights off. Don't get them excited. And you have these animals half sedated and in the dark. They can't go play. They can't go on trips with you. No one can visit. And it's very difficult because it's just a very weak membrane, okay? And then we have remember we talked about the respiratory tree? The tree trunk is the trachea. The bronchi are where these are the branches of the tree, and that breaks off. Do you guys have another pointer in the back by any chance? No? Okay, I don't know if maybe Jackie went to get one. But basically, let me see if I could use this. Can you see this here? Oh, here we are. So these are the bronchi. These go out to the lungs, the parenchyma of the lungs. That's the alveoli. That's where the gas exchange takes place. And those are like the leaves of the tree. That's where gas exchange takes place. Jackie, do we have any more? Oh, someone's getting one? Okay, great. Okay. So that's basically what we're dealing with in terms of the trachea. Now, this is a scope. we're looking in this trachea. You see these normally C-shaped rings with this membrane, and as we get down into the chest, it's completely obliterated. I don't know if you could see that. We'll show it again. The beginning, that's the voice box. In here, nice C-shaped cartilage is right here. And then this membrane, when we get in the chest, is just floppy. It's completely closing off. That should be a rigid tube, okay? And that dog has a big problem because if there's no integrity of that trachea, he's not going to be able to breathe. And you could give medicine to keep him quiet and stop coughing, but medicine isn't going to make that tube become open again, okay? And that's where surgery comes in. Now, this is a stent. For those of you who have never seen a stent, like a cardiac stent, it's just a little metal tube. It kind of looks like a slinky, and that's the stent right there. You're watching the entire procedure. So this is a marker catheter that's in the esophagus that lies right next to the trachea, and this gives us an idea of measurements. Here's the spine going up to the head of the dog, okay? So this black is bone. These are the forelimbs coming down here. These are the ribs right here. This is a tube. This dog is intubated, meaning there's a tube in the trachea, and the stent is placed through that tube, and you deploy the stent. It comes on this little kind of tiny catheter, so you could fit it through the tube, and then when you constrain the stent, when you pull the tube back, the stent opens up. And this stent is inside the trachea, holding it open, so it doesn't dynamically collapse anymore, okay? This is prints the next day. So the volume's on, he's running around. He's looking to try and go home. This was a long time ago. This was back when I was at Penn. But he's running around. Often there's some coughing after a stent, but he's not showing any coughing. This dog responded very well to a stent. He's just going on about his business. He's just trying to get out of here. So there's no surgery, right? This is all done through the mouth. There's no incision for anything like this. And these dogs can do very, very well following a stent, but there are problems with stents also, okay? And we'll talk about that. Off into the sunset. Prince. Okay. So those of you that have come into our service, you'll notice we ask you to grade the tracheal collapse in terms of the clinical signs. So because we put stents, some dogs do great, some do terribly, some need a lot of meds, some don't. It's a very wide range of experience that we have with this, and that's why it's very difficult one-on-one to tell you if your dog's going to do well. So we said a bunch of years ago, about 10 years ago now, we have to try and differentiate these patients to figure out what's different among them. Maybe Poms do different than Yorkies, or males and females. You know, young dogs and old dogs. So we had to kind of figure out what are their clinical signs. Most of the time we talk about clinical signs like a goose honk cough, or that raspy breathing, the okay, that's kind of a goose honk, or a raspy breathing sound, or the goose honk that sounds like a goose. There's also coughing, like a that type of sound. And then there's dyspnea, which is trouble passing air. If animal has dyspnea, they're having difficulty breathing, okay? And that can look many different ways, but dogs aren't like sniffing around and want to play when they're having trouble breathing. They sit there, their neck's out, and they're just thinking about getting air in. Their tongue might be blue or purple. So we have people grade this on an 11-point grade from 0, it never occurs, to 10, it's intractable, occurring all the time. And it's a very subjective thing, but what it tells us is my 5 might be different from your 5, but your 5 is always going to be your 5. And it gives us a sense of how bad this problem is. And if it's 3 or lower, we think this is a mild problem. It's 4 to 7, it's a moderate problem. It's 8 to 10, it's probably a severe problem. And we started changing this. We started doing this for every patient we saw in every recheck to figure out which signs does a stent help with, or surgical rings, because sometimes we do surgery on the trachea also. Which signs are most helped with a stent or rings, and which don't respond, okay? So that's how we started kind of looking at this. If trouble passing air isn't a problem, if breathing is okay, it's just coughing or honking, raspy breathing, then we have the luxury of time to tweak some medications and try some different things, because we're not worried about trouble passing air. Because what I always tell, and you may have heard this before, as I tell people, you don't die from coughing. You wish you were dead, but you don't die from it. You die from not being able to pass air. We have a lot of medications. These may be familiar to some of you. Vicodin or hydrocodone. It's an opiate drug. It's a class 2 drug. So this is a drug that you can only give a month out at a time because it can be abused. This is a cough suppressant, causes a little bit of sedation too. Fluticasone is an inhaled steroid. So steroids are probably something that works the best for this problem, but there's a lot of side effects of steroids. We try and maximize the Vicodin, the cough medicine, and then when that's not keeping the coughing or honking down to a 3 or less, then we add steroids in. Trazodone is a good anti-anxiety medicine. This is something we do if you say, oh, my dog's usually fine, but if he gets really excited, then he gets into a crisis. So if we keep them on an anti-anxiety medicine, that will often take just the edge off a little bit. And then antibiotics, we don't know, or we didn't know historically if this was helpful or bronchodilators, and I'll talk more about that. So what I want to do is compare what we thought about tracheal collapse and what we know about it now. And we're going to go through these questions. One is that tracheal collapse is a weakness of the cartilage, like I told you. And that was really, is this the most common cause, that you just have this weakened cartilage? Because that's what you learn in vet school, that the cartilage loses integrity and gets very weak, and we often talk like that. That medical management is an effective way of controlling signs. Your vet may have told you that, I may have told you that, oh yeah, your dog has tracheal collapse, put him on meds, usually helps. Infections are uncommon with tracheal collapse. People have looked at this historically, where they've taken samples of the trachea and cultured it to find out if infection was a problem, maybe infection's damaging the cartilage or something, and that historically wasn't thought to be a problem. And that other airway issues are common, like laryngeal paralysis. That's where your voice box is paralyzed and it can't open when you're breathing, so you have difficulty breathing. Stenting is a safe and effective means of treating tracheal collapse. We think that might be the case. And that if your bronchi, your dog's bronchi are collapsing, remember the tree branches? We can't stent every little branch. It's like looking at a tree. I mean, every half centimeter there's another little branch coming off. You can't put stents in all of the airways. We can only put them in the large major airway, the trachea. So if your dog has bronchial collapse, which is the extension of the tracheal collapse going down into the bronchi, then there's not much you can do. And a lot of people don't even pursue tracheal stenting when their dog also has bronchial collapse, because that's a very common misconception. And then, will you need long-term medication if you do medical management, if you do stents, if you do surgery? What's going to happen? So what's the first thing? Tracheal collapse, weakness of the cartilage. So is that really what tracheal collapse is? Because that's what we've all learned, and that's what it says online. And this is a paper came out, I don't know if you could see here, it's like in the 80s that this paper came out. And you may look online, they talk about grade 1 collapse or grade 2. And this is looking at a normal trachea, this C-shaped cartilage ring with that little membrane on top. And then they talk about 25% loss of the lumen, 50%, 75%, and 100% loss of the tracheal lumen. That's grade 1, 2, 3, and 4. And this paper was describing the surgery where we make an incision in the neck and put rings around the trachea to hold it open from the outside. And that's something we still do occasionally for very young dogs, where we don't want to have to keep a stent in for their whole life. We do this surgery, but there's a lot of complications with this surgery. And this paper was saying, if you have a grade 2 collapse or 3 or 4, then you should do the surgery, okay? And this was a progression of collapse, that it goes here to here to here and then to here. And you can see this tracheal cartilage is kind of shaped like a W, okay? When we take x-rays, and I don't know how well you can see it with all the lights, I don't know if the lights could come down or not, but this is a radiograph of a dog with the spine. Here are the forelimbs coming down. So white is bone. These are the ribs. This is the heart. Gray is kind of soft tissues, and black is air. So this is air in the trachea. This is air in the lungs, and this is a nice wide open trachea, and the trachea is really wide up here. Here's a dog with a trachea that's very wide, and you see how that black line filled with air tapers down? It just gets smaller and smaller. That's a dog that has collapse of its trachea inside the chest, and it's actually collapsing the bronchi also. Here is a tracheal line, and then it goes away, and then there's a trachea here. This is maybe a congenital problem, some type of narrowing or stenosis, where it gets very narrow part of the trachea. That could be considered a tracheal collapse. And then this is the one I want to focus on because you see these lines, there's this bump right here, and I'm going to show you a better picture of that. I'll show you a better picture of that in a second, but the typical tracheal collapse is that you see this trachea get kind of flattened out, and you see this membrane kind of hanging down in the lumen of the trachea, right? Like that scope that I showed you where the lumen just went away. And if you look at that from the side, what you see is a wide open trachea here, a wide open trachea here. These are different types of images, so the images are reversed, but you see this line coming right down here. There's air here. We see a little bit of air down here, and then it gets wide again. So this is tracheal collapse. Here's another one. Wide open trachea gets very narrow in here, and then open again. Wide open trachea, very narrow in here, and then it gets open again. And this one is a little bit different. And the close-up view is, on this one, we see the air here, and then the little sliver of air here is on the top of the trachea, not on the bottom of the trachea. Why is that important? Here's that first image I was showing you. Here's a dog with tracheal collapse, but we don't see this membrane just kind of hanging down. We see this kind of bump right here. Do you see that white bump right there? And the lumen of the trachea is up here. What that is something we've recently recognized as a tracheal malformation, okay? So we talk about the traditional tracheal collapse that's reported of that flat trachea with that membrane, but we also see a tracheal malformation. This is in younger dogs. So if your dog has tracheal collapse and is diagnosed very young, it's often a malformation. Much more common in Yorkies. Always at the thoracic inlet, okay? And responds less well to medication, okay? And what you see here is the trachea, that tracheal collapse I showed you before, that kind of traditional one. This is the malformation where you have a C-shaped ring cartilage right here, and then you have another one here with this bump right here, okay? This is what it looks like when you scope this dog. C-shaped cartilage rings, okay? And then this W-shaped cartilage ring right here. And you can see this cartilage is hard. It's not malastic or weakened or anything like that. So this is tracheal collapse also, and then it's fine behind it again, these nice C-shaped cartilage rings. This has never been described before. We just described this last year. And this is very important to identify. This is what it looks like when we put a stent in the trachea. So this is the stent holding the trachea open, okay? And we want the stent up against the wall, and you can see that bump is pushed down, and this is the tracheal stent inside the trachea. So it's holding it open. And the difference with the malformation is because it's hard cartilage, it's not that really weak cartilage like the traditional collapse, is that meds are not going to get rid of that airway obstruction, okay? And that's bronchial collapse. Those are the little airways all collapsing right down there, okay? This is what it looks like when we put a stent in this dog, and we don't have to spend a lot of time on this, but every time we see the breathe, we see the trachea getting wider here, okay? But it never really changes right here. The issue with the malformation, it's a static obstruction. That means it's always present. It's always present. Whereas the traditional collapse, that floppy cartilage and stuff, it's dynamic. So you may take a radiograph and the trachea is open. You may take a radiograph and the trachea is closed. So sometimes it can be missed on radiographs. So this is always present, and it can prevent the stent from opening up, these malformations. So they're completely different types of problems. And if we put a stent in a malformation dog, because we have this W-shaped cartilage instead of a C-shaped cartilage, if you have a C-shaped cartilage like the traditional collapse, the stent fills it in very nicely. But if you put it in a malformation dog, there's these gaps in between the stent and the wall when they have that really hard cartilage, and you can get mucus accumulate in there and get infections, and it's very important that we're aware of that when we know it's a malformation and we're doing surgery or putting a stent in, that we get rid of those gaps and we're aware of it, because that will lead to chronic infections, tissue ingrowth, and complications. Now, why do these occur, these malformations? I showed you that old paper where it showed progression of grade 1, grade 2, grade 3, grade 4. Well, what they didn't realize back then is those grade 4s, we think, are the malformations. And it's not progression from 1, 2, 3 to 4. The 1, 2, 3 might be a progression, but that 4 is actually a separate type of tracheal collapse. It's a different phenomenon altogether. Here's a CAT scan. We're going through a dog like slices of a loaf of bread, okay? So again, white is bone, so here's the spine. Black is air. This is all muscle, this gray, and some fat here. So black is air. That's the trachea right there, and there's the tube inside the trachea. There's the trachea. You see how narrow it gets? And then it opens up again, okay? This dog has a malformation. What you're going to see is this kind of shape of it. You see that kind of W-shaped cartilage, and what you'll see here, right here, is a blood vessel that's going right across there, that little blood vessel. That blood vessel is crossing right along where the trachea gets narrow, okay? Here's another one. Here's the trachea. There's the blood vessel coming across, and it's coming across right as the trachea gets narrow. So we started looking more at that, and what you see is this vessel is crossing right over the trachea where the narrowing is. And sometimes in babies that are born with these transposed great vessels of their heart and stuff, and cardiac surgeons go in and they completely change the way the blood flow is going through these different veins and arteries. Sometimes these vessels that are abnormal are compressing airways. And if they compress airways chronically over periods of time, the cartilage can get weak. And what we don't know is there's something about these Yorkies where there's a vessel crossing this cartilage during embryogenesis or its development when the cartilage is incredibly weak and putting tension on that. And then as the cartilage hardens, it's already in an abnormal shape and has that strange shape. So this is what we're still trying to find out. But certainly this is very strange that that vessel is crossing right where we see that malformation. Now here's a malformation, and in this case, we put rings on. And sometimes we'll recommend rings where we cut open the neck and put rings around the trachea, and we do that in patients that are very young, because we don't like putting stents in 2-year-old, 3-year-old dogs. We can talk about that why. So, is tracheal collapse weakness of the cartilage? Yes, in traditional collapse. But we looked back at 150 cases, right? Your patients may have been in, your dogs may have been in here, and 70%, about 2/3 are traditional collapse, but 1/3 of the tracheal collapse dogs we see have these malformations, okay? And what's more interesting is that when you look at all the traditional dogs, there were 107 of them, and the malformation dogs, there were 43. The traditional collapse dogs, over 10 years or so, 35% of them ultimately failed medication and needed a stent. Okay, 1/3. The malformations, almost 90% of them failed meds and needed a stent. So now when you come into my office and say, my vet said my dog has tracheal collapse, right? And we take a radiograph and we go, your dog has a malformation. Just so you know, we looked at 150 dogs over 10 years, and there's about a 90% chance your dog is going to fail medical management at some point. So maybe we should see you sooner. Maybe we should see you more often. Maybe we need to get more on top of this. Whereas if you have traditional collapse, there's only a 30% chance, or 1/3 of them. So that's useful information when you're discussing things with a client. Okay, what about medical management? How long will my pet need to be on medication, and does it help? Well, this is our database. 100% of our tracheal collapse dogs. Now, by the time they see me, you know, my caseload is probably biased, right? Your vet has diagnosed your dog with tracheal collapse. They sent you to us because they think you need a stent or they want you to talk about a stent. So I'm seeing kind of maybe the worst of the worst, okay? That may be the case, but all of our dogs are on cough suppressants, some as needed, some just constantly. 80% are on steroids, 1/3 are on anti-anxiety medicines, 1/3 on bronchodilators. So these animals are on a lot of medication, and that's hard on owners. What about the duration of clinical signs? Before, how how long do the clinical signs go on before you fail medical management? Okay? So how long will it be if you come in and say, we're going to start medication for your dog? How long is it going to be before my dog fails medical management? Well, one is it malformation or traditional collapse, right? Because we have to kind of figure that out first. But in general, what we say is about a third of dogs will need a stent within a year. About a third of dogs will go 1 to 3 years. And about a third of dogs will go greater than 3 years. That's a huge range, right? But in general, we say it's about 1 to 3 years, okay? Some are diagnosed at 14 years of age, and some are diagnosed at 2 years of age. Is medical management effective at controlling signs? Yes, it is. But at some point, these animals will fail medication. And our range is from 3 to 2,400 days, right? So that's a long range. That's the earliest one failed meds in 3 days, and the longest one went 2,400 days before it needed, years and years before it failed medical management. So each dog's going to be a little bit different. The comorbidities, meaning what other problems does it have? Does it have heart disease? Is it obese? Does it live in a family where a family does smoking? Is it in a very hot, humid climate? Or is it in a cool, non-humid temperate area? So all these things will play a role. This is data that's not published yet. This is coming out in a paper we have from all this data coming out very soon, probably in the next year or so in the veterinary literature. This is what's called a survival curve, okay? This is all the dogs. This is 100% of all the dogs. And this is over time, how long they lived, right? So as each animal passes away, this drops down. You start with 100% of the dogs, and then 99%, 98%, and you get down here. So when we look over 3,000 days, 3,500 days is about 10 years, right? When we look here, only about 15% lived 3,200 days. That's how you read this type of thing. And this is when people say, oh, how long is your dog going to live? If your dog has cancer, or if a person has cancer, or they have heart disease, they say, oh, 3 years is how long you're going to live. And the doctor is never right when they say 3 years, right? Everyone has a story of how the doctor said my dog would live a month, and they lived 5 years, or they said the dog was going to live 5 years, and it lived 2 months. That's because they're not telling you how long your dog is going to live. They're telling you a median survival. That median survival is determined by this graph, where you draw this line from 50% of the animals, and draw it down, 50% of the animals, and this is what it looks like. It's the median survival. So this is if your dog gets a stent. This is if your dog has medical management. I started out by saying this at the beginning of this talk. No one can tell you if your dog has tracheal collapse how long it's going to live, right? Now we can tell you. Not your dog, but a group of dogs. A group of dogs that only received medical management through our service, 3.7 years. Now, that doesn't mean every dog lives 3.7 years. That means half lived longer than that and half lived shorter than that. That's what people tell you when they're talking about survival times, that you're likely to 50% chance you'll live longer, 50% you'll live shorter, okay? Now, that's horrifying for me to finally find that data, because this is a benign problem, and you live 3.5 years, median survival, that's terrible. When you look at the stent population, they live 2.75 years, okay? That's less than the medically managed population. So you say, why would I ever want to do a stent? Because these are different populations of animals, okay? When we look at the medically managed dogs and the tracheal stented dogs, the medically managed dogs had much lower honking and dyspnea scores. Remember we talked about the scores? The scores were very low in the animals we gave medical management to. People said, oh, it's a 3 or 4 or whatever. No big deal. That's moderate. Keep going with the meds. The dogs that had stents, 6 was the median score. So their scores were approaching the severe end, okay? So you can't compare apples and oranges. We're not going to just treat dogs that are severely affected with meds, and we're not going to put stents in dogs that have very minor clinical scores, right? So you can't look at those numbers and compare them. Interestingly, the medically managed dogs were almost all, 70 out of 75 dogs, were traditional collapse dogs, where the stented dogs were 50-50, okay? showing a lot more of the malformation dogs fail medical management and need a stent. Medical management alone, dogs with medical management alone, 84 dogs. When you give me those scores, you'll never remember what you told me. You won't, but I write them down. And we write them down and we look and we see what's happening with your dogs over months and over years. And we see that when May and June come around and it gets hot, the scores might come up, and then we increase the meds. And then as it cools down in the fall, they often get better, and we'll drop the meds a little bit. You could see these seasonal fluctuations. But what we found is that if your dog has one severe score, the median survival is 1,300 days. Two severe scores, it goes down to 750, and three, it goes down to 585. So what that means is the more severe scores your dog has, your scores, not mine, the scores you tell us, and you always say, how will I know something's wrong? You guys know better than anybody. Because sometimes your dog comes in, it's not making the sound that it makes all the time. Or sometimes it comes in and it's only making the sound, and you're like, believe me, he's never like this at home. You know, it's just because he's here and excited. But you know what the problem is. You know a lot more than you think. But your scores are predictive of your dog's survival. Okay? It's important. What about infections? Does your pet need antibiotics? Well, I already told you, we learned infections have nothing to do with tracheal collapse. You don't need antibiotics for tracheal collapse. This was an old paper came out. We always quoted this paper where they cultured the trachea of dogs with tracheal collapse. 83% of them were positive. But we're all our tracheas are going to have positive bacteria. We're just breathing bacteria in all the time, right? And our trachea has these little cilia on them that bring up everything we inhale, the dust and bacteria and particles, and it all moves up into the back of our throat, and then we just swallow it. That's what we're all doing all the time, okay? But when your trachea is collapsing all the time, those little cilia on the lining of your trachea, they go away, and you can't do that with bacteria anymore, and you get these deep-seated infections, we think. So the 83% positive cultures, they said, well, there's no evidence of infection. There's just normal bacterial growth. It's nothing problem. But these were dogs that were just diagnosed with tracheal collapse. First time they're diagnosed, they go ahead and get cultures. We did the same thing, but we don't culture them when they're first diagnosed. We culture them after they've been on medication and they're failing medication and they need a stent. That's when we culture them. And when we culture them, we also had about 80% positive cultures. But when we looked at the dogs that had also inflammation of the trachea and bacteria that was taken up by the white blood cells and signs of infection like radiographic infection of the lungs, 2/3 of them. So 2/3 of our dogs with tracheal collapse actually have bad infections going on. Okay? So that's a real problem, infections in these dogs. And that's very important that is recognized because we need to be putting more of these dogs on antibiotics and getting samples of what's growing in their trachea. What about other airway issues like laryngeal paralysis? Laryngeal paralysis is where your voice box, normally when you breathe, it opens up, right? So you could breathe, and then if you take a sip of water or some food, it closes so food doesn't go in your trachea. It goes in your esophagus. Now, if it's paralyzed, it just sits there. It doesn't close when you drink, so you start coughing up, and every time you drink water, you cough. And when you breathe, it doesn't open up, so it's hard to breathe. Well, this was reportedly 25% of tracheal collapse dogs. We didn't find a single dog that had laryngeal paralysis, but many of them have soft palates that are long. If you put your tongue on the roof of your mouth, that's your hard palate. And if you can go farther back, which you probably can't, is your soft palate. And that soft palate, when you eat food, goes up against the roof of your mouth so food doesn't go and come out your nose. That soft palate is very long in these tracheal collapse dogs because they're constantly breathing so hard. 1/4 of them also need surgery on their soft palate. And if you leave it long, it's hanging back by your voice box, and food gets stuck in it, and you get reflux and bacteria goes into your trachea, like GERD, gastroesophageal reflux disease, which you hear more and more about, coughing from reflux and stuff, and people, they talk a lot about that. We think this happens a lot in dogs too. So we always check their soft palates. because that could really contribute to a lot of their breathing problems. So some of these dogs, 1/4 of them need surgery on their soft palate, and it can dramatically help them. They may not even need anything done for their trachea. Is stenting safe and effective? Okay, how safe is it? Well, if we put a stent in your dog, what we tell people is 95% chance your dog's going to go home tomorrow. It's incredibly safe. And I think it's even, this is kind of 94%. This is 6% that animals didn't survive to discharge. And I think that's an overestimate, because sometimes we'll have a dog that comes in that was at getting a dentistry somewhere or rushed from another hospital that has a tube in its throat, and they're in the taxi like breathing for the dog. Its lungs, it aspirated, it has terrible lung disease and heart disease. And the owners are like, we want to try something. You got to get this dog, the tube out of the dog so it could start breathing on its own. And for those dogs, sometimes we'll stent them so we can get them, because they have such severe tracheal collapse. We'll put a stent in to try and get them extubated. But these are kind of heroic type of situations. Those are kind of the dogs that are in that 6%. Sometimes you save them, but when they're really that bad, you often can't. But we would never try that dog on meds, wake it up, extubate it, and give it antitussives, cough medicine. That dog would die if it didn't have a patent airway. So we do these because it's non-invasive, non-surgical approach, very fast to do just through the tube. We'll often do it in patients as a last-ditch effort. So I really tell people 95% plus chance if you get a stent, your dog's going to go home. But a lot of dogs don't need stents, okay? What about the clinical signs? Well, these are the scores you give us, that 0 to 10. Remember I told you now that 0 to 10 for honking, raspy breathing, your dog's doing that. It's a 7. This is all the dogs average. So the starting value was about a 7 from all of you guys, telling us where the honking, raspy breathing was. We put a stent in, immediately drops down. And then over the years, 4 to 5 years, it tends to creep back up, because maybe the collapse is spreading down to the lower airways or beyond the stent or something like that, right? So honking, raspy breathing, very effectively treated with a stent. Coughing that, okay, starts about a 3 or 4, stays about a 3 or 4. So if your dog's problem is the coughing, not the goose honking, but regular lower airway cough, a stent is going to make it worse in 40%, maybe better in 40%, and do nothing in about 20%. So stenting is not very useful for a dog that has a lower airway cough. That's why we spend so much time. Show me a video of your dog making the sound. Me pushing on your dog's trachea. Is that the sound that he makes? No or yes. All that's very important, because I don't want to put a stent in your dog if it's not going to treat it. Okay, so that's why we go through that. Videoing your dog when it's having one of these episodes is always very good to show your vet. Trouble passing air? Great. You can't breathe, you put that stent in, air is going to pass. So that's very, very useful for that. Is it safe and effective if you put a stent in? Well, yes, it probably is, but there are a lot of complications that happen with stents, which is why we just don't throw them in every dog. They can have a lot of problems. They can fracture, they can get tissue ingrowth. About 40% of the times we put a stent in that dog's life, it will need another stent, okay, in case it fractured or had tissue ingrowth. What about the bronchial collapse? Is your dog not a candidate for stenting if your dog has bronchial collapse? Here's a picture of a nice wide open trachea, and then we see it get very narrow here, and this is where the bronchi are coming off, and it's just very collapsed right there. So this dog has bronchial collapse, okay? Now, we see bronchial collapse with a lot of things. 70% of our dogs with tracheal collapse that we put stents in have bronchial collapse, okay? So most of them have bronchial collapse. And there's this question of, often it's the left bronchus, usually it's the left, the bronchus, the tree comes up and it splits into the left and right side, and it splits more and more. And usually the left side is the one that's collapsing. And people don't know why it's the left. And they think that, oh, maybe it's the left because of the length of it or the airway pressures, the different sizes of the lungs and all this stuff. But people know that if your heart gets enlarged, you can get compression of your left main stem bronchus. So, but even if you don't have heart disease, a lot of these dogs will have problems with their bronchus, and no one ever knew why it was. So we started looking at this. Does anybody have a dog, a boxer in here, or a deep-chested dog? We think about a boxer, we think of that deep-chested dog. You know, that kind of really long chest like this? This is that CT of a dog. This is a normal dog. The next CTs I'm going to show you are all normal dogs, okay? No problem in their chest. They were CT'd for a mass on their head or their leg or something like that. So nothing wrong with their heart or lungs. A deep-chested dog. You know, people, we all have pretty much the same conformation. But when you think about dogs, they're all different shapes and sizes, right, and conformations. So this is what we call a deep-chested dog. So you could say, this is bone. White is bone, so here are the ribs coming down. That's the spine. This gray is soft tissue. That's muscle. This is some fat. This gray is the heart. Okay, this is the heart right here. This is the lung, air-filled lung right here, air-filled lung right here. This is the sternum, okay? So the back and the sternum, and this is air in the esophagus. This is, if you imagine the trachea coming down and then just splitting into two sides. This is the right side, and this is the left side, okay? Here's the heart. This is the aorta, which is that big artery that comes off the heart that feeds your whole body pretty much. And you can see here, there's a lot of space here to fit in your aorta, your left bronchus, your right bronchus. They just sit right on top of the heart. A lot of space between your aorta and your bronchus here, and your aorta and your vertebral bodies up here. Now, the left bronchus, I know this is kind of technical, but believe me, there's a reason behind this. The left bronchus has to cross over to the left lung between the aorta and the heart. The aorta is always there, the heart's always there, and the left bronchus always has to pass in between them, okay? So keep that picture in your mind. This is a pug. A pug we think of as a barrel-chested dog, okay? So here we have the heart. Look where the aorta is. It's pushed all the way up here. It's above the vertebral body, right? Remember how the other one was way down? You see the aorta here? You see all this space? When you compress this, the aorta's up here. This bronchus, right and left, has to cross between the aorta and the heart. It's kind of right there. There's not much room, right? This is a Yorkie. Again, maybe more barrel-chested. Look where the aorta is. This bronchus is compressed between the heart and the aorta. It's squeezing through there because the chest has been compressed. Its conformation has changed. And you know, if you have a Yorkie, you've seen Yorkies. Yorkies are this big, they're barrel-chested, they're deep-chested, they got little tiny legs, they got big tall legs, right? There's tons of different conformations of Yorkies. So just say, oh, it's a Yorkie. Well, which Yorkie is it? You know, look at this. I mean, you could see that without any problem, if this heart got a little bit big, this bronchus would be compressed. If this dog had any tracheal collapse, that's already narrow there. And if you took a radiograph of this dog, you would see that bronchus was compressed or collapsed. And you would say, your dog has tracheal collapse and bronchial collapse, you can't do anything for him. That's not true. It might not be collapsing, it might just be compressed, okay? Here's a French bulldog, okay? And you can see how all this is packed in here. The sternum is kind of sticking up here and the heart's pushed off to a side. This dog wasn't even having any breathing problems. But you can see the whole lung is compressed here, but this was not even for a problem with his chest. So you have to kind of think about the conformation of these animals. And that's why when we think about the different conformations, when we look at your dog and think, is this likely bronchial compression? Is it bronchial collapse? What are the clinical signs, right? Your dog's honking or coughing a lot. Let's say it's honking a lot, and the dog's got collapse. And we say, well, he's having dyspnea. He's doing a lot of honking, raspy breathing. Is it the bronchi? Is it the trachea that's inside the chest, or is it the trachea that's in the neck? Which of the problems is causing these signs? So if I push on the trachea and you go, that's the noise he's making, well, then that's probably not the bronchus, that's the problem. And when we do put a stent in those dogs, they get much, much better. The problem is the dogs that have that big expiratory problem. Because when you expire, your chest wall compresses, your lungs compress, your trachea in your chest compresses, your bronchi in your lungs compress, everything gets compressed on expiration. On inhalation, your chest wall expands, your lungs expand, your bronchi expands, your intrathoracic trachea expands, everything gets bigger, and as air is sucked down from the atmosphere into your lungs, and that sucking causes your trachea in your neck to collapse. So it's dynamic, the inspiration and the expiration. Is it the neck trachea? Is it the chest trachea? And that's what we do in our physical exam. We try and determine which is the real problem, or is it the bronchi? And usually we can tell. So that's a long story short to tell you that whether your dog had bronchial collapse or compression made no difference in the survival. I showed you these curves. They're the same. Here's 50%, no significant difference, okay? So if your dog has bronchial compression or collapse, they could still do very well with stents. So we get people that come to us for a second opinion because someone said there's nothing we can do. And this information has to get out there, so we're going to get this information out there soon. Is long-term medical management necessary? Yes. Your dogs will need long-term medical management. If you don't have a stent, if you do have a stent, if you do tracheal rings, often they need less medical management in these young dogs because we think a lot of them have malformations. They don't have any other comorbidities and health issues because they're young, healthy patients. So we don't put stents in because people are tired of giving meds to their dogs. Say like, oh my God, I can't give any more meds. Can we just put the stent in? Well, your dog's still going to need meds, okay? I'm afraid to tell you that. So we talked about what tracheal collapse is, or what it was and what it is today. It's a very different thing. There's a variety of them. We talked about medicine, how long you'll need it, what meds you'll need, that you're going to need it for life. We talked about the prognosis with medical management, with stenting. And that stenting, that 2.75 years, is added on to when they fail the medical management. So maybe three-quarter years, and then another 2.5 years, 3 years on top of that. For the middle, right? The middle, not your dog. Your dog might live 10 years with a stent, or 10 years with just meds, or your dog might unfortunately die a week after an airway crisis or something. So I can't tell you what your dog is going to do. I can tell you what populations of dogs do. And that helps. That helps advise you on making decisions, because it's not inexpensive to do this. It's emotionally this is a difficult disease for people, parents of tracheal collapse dogs. It's horrible watching an animal have difficulty breathing. And how can we learn more? Get involved in a study, get involved in a trial, support research into this disease. All these things, you'll learn a lot more. And I think we just have 5 minutes for some questions.
I just wanted to ask one question to you, Dr. Weisse, to start it off. You mentioned taking a video of your pet to assess the cough, how that's very helpful for you. How else can people make sure that they have a productive visit with their veterinarian? Is there anything else that they can do for that?
Jackie, that's a great question. One thing I usually tell people to do is keep all your own dog's medical records. Because what happens is your vet said they were going to send you the radiographs and they didn't send them the radiographs, or maybe they did and we lost them, or they went to the wrong email address, and then we're scrambling to try and get the x-rays that you guys already took, and then we have to redo them if you don't, because they were just taken 3 weeks ago or yesterday, and I can't believe you didn't get them yet. And your vet says we sent them and we said we didn't get them. And half the day is getting your vet on the phone or to email the records and then get them uploaded to our system. Anytime your dog has any blood work done, anytime your dog has any imaging done, CTs, radiographs, say, I would like those on a jump drive or emailed to me on a disk or whatever, however you get them to you, get them and save them, ideally on a jump drive, because a lot of us don't use disks anymore. But if you have a digital copy, all my animals' imaging is right here. That will save you a lot of time. And the blood work, have it all copied, and whatever you have, if you bring it with you, don't rely on anybody else to do it.
Great, thank you. A management question. Is it better to have warm, humid air or cool, dry air in the apartment for your dog?
It seems like cool dogs tend to do better in cooler weather. Some people feel like they do better in warmer weather, but that's more the exception than the rule. Most dogs are worse when it's humid out. And it might be just those times of year. There's more pollen and stuff in the air, but because certainly we're sometimes in the summer, the air gets very dry from the air conditioning. So people say, "Oh, I think it's really dry from the air conditioning," and that might be, But certainly, as the temperature goes up, we see a lot more tracheal collapse dogs coming through the ER and through our service. And as it gets cooler, we see fewer of them, and we can often drop meds. So I think as a whole, most of the time, people who live like in Florida half the year, sometimes they'll say, oh, they're much better in Florida, or they're worse in Florida if they go down too early and it's really hot and humid. So it kind of depends. But in general, if you move to a nice, cool environment, your dog will probably be better.
Thank you. Can you speak to what actually causes tracheal collapse, whether it's congenital or there's some underlying cause?
So no one really knows. If you look at tracheal collapse, if you look at the weak cartilage and you actually do testing on it, you'll find that there's decreased calcium content in it. Glycosaminoglycans is this kind of thing that, if you have big dogs with arthritis, you may give them glucosamine or things to help their cartilage, and that's to prevent cartilage from getting weakened over time. And we think that because that's hyaline cartilage in your joints, it may be a good idea to give animals at predisposed risk for tracheal collapse glycosaminoglycans also, because why would it be any different if your cartilage in your joints hyaline cartilage and your cartilage in your trachea is hyaline cartilage? If it's helping that from getting weak, maybe it'll help your tracheal cartilage. So they get decreased glycosaminoglycan, and there's no science behind that. That's just something we've thought about. There's decreased calcium content, but we don't know why that occurs, but we know that that's kind of what is in the nature of the traditional collapse. Well, there's definitely something genetic, right? Because we see it in 75% of the animals are Yorkies and Poms. So that doesn't mean every Pom is going to have that has tracheal collapse will have a baby Pom with tracheal collapse. It's not like a single gene probably, but it's probably multifactorial. But because we tend to see it in similar breeds, the breeds are predisposed, we think there's a genetic component to it. So we think it's, it might be congenital, but congenital really just means present at birth. It doesn't mean it's hereditary, right? So you could have a congenital problem that is not hereditary from your parents. It could be just something that happened in your own development. But because we see it in the same breeds, we think there is a genetic component. How many of you have Yorkies? How many of you, your Yorkies all have tracheal collapse? Does anyone have a Yorkie that has a liver shunt? Do you know what I'm talking about? Yorkies get a lot of liver shunts. This is a congenital vascular abnormality. And they're very common in Yorkies. And I see a lot of liver shunts, and I see a lot of tracheal collapse. And one of the things I've noticed is that it's very uncommon to have a Yorkie that has both a liver shunt and tracheal collapse, which makes me think that they may be closely linked, because it would just be there's so many Yorkie shunts and so many Yorkie tracheal collapses that why would we not see them together? So it makes me think if we find out the genetic cause of one, it could be a similar gene or chromosome or something.
I think this is one question that a lot of people and a lot of owners ask themselves is it painful for the dog?
No, it's not painful. It doesn't seem painful is one thing. The other thing is Vicodin is a pain medicine. Okay, we don't know how analgesic it is in animals, but it's a very strong pain medicine in people. So I think that it's an opiate drug. It's an opioid drug, so that's why it's a controlled substance. So even if it was painful, they're on a lot of pain meds, horse doses of pain meds sometimes. But I don't think it's painful because they're happy. You push on their trachea, it doesn't bother them. It doesn't seem to be painful at all. So I don't think there's nothing that suggests to me that this is a painful problem. It's just painful to watch someone having trouble breathing.
Of course. And does age affect collapse?
Well, it probably doesn't affect, it might affect what type of collapse. So we know older dogs, if we put a stent in a dog, and it's an older dog, it lives shorter than if we put a stent in a young dog. And that might be like, well, of course, older dogs don't live as long as younger dogs. But if the stent was causing the animal to die, right? If it was a problem with the stent, it would cause an old dog and a young dog to probably die at about the same time. So the reason we think older dogs live shorter than younger dogs is because of the comorbidities they have. One has more heart disease and renal disease and endocrine disease and all these other problems. That's one reason we think older dogs don't live as long. The other reason is the older dogs are more likely to have the traditional collapse, that soft, floppy membrane that spreads down the bronchi, where the younger dogs are more likely to have that hard malformation that's not chondromalacic or weakened cartilage. And if you repair that, it doesn't tend to spread up and down the trachea. So that's why we think the younger dogs live longer, but they're also more likely to have malformations than traditional collapse.
All right, great. A lot of the other questions I think might be best served with a one-on-one consultation.
And we have a couple, just some quick ones right here.
Okay.
Yeah, so what we see a lot of dogs, the question is what happens when they have all these other health issues? Kidney disease, heart disease, all these other things. We maximize the medication and treatment of those other conditions first. So if your dog has a heart murmur, we get an echo, we have cardiology do everything they can, get all the meds that they can do. And if they say, well, he's on all the meds, I don't think it's his heart, or we can't do anything else for the heart, then we say, well, how much of it is the heart, how much of it is the trachea? And sometimes, unfortunately, what we have to do is a test that costs about $6,500, and that test is putting a stent in. And if they get better, it was the trachea, and if they don't, it's the heart. And that sounds crazy, but sometimes you just don't know, because the heart affects the lungs. You have the heart, the lungs, the bronchi, the trachea. All of these things can have similar types of clinical signs, so you do your best with your medical management, and when you go, my dog's quality of life is such that I don't think it's fair to keep him alive like this, then you make the decision. Do you want to try something that may help? We think there's a good chance it might help. Usually we have some idea of like, I don't think this is going to help, or I think there's a good chance this can help. But often, I think it can help. But it's a case-by-case basis.
All right, so unfortunately we are at 7 o'clock. We have to respect everyone's time. We have to be out of this room by some point. I appreciate everyone's enthusiasm. Thank you so much for coming tonight. Please fill out the surveys and drop them off outside. Thank you, Dr. Weisse.
Thank you, everybody.